The Konzo area I have explored myself in 1996, of course, the one I was involved with Fogarty-funded was about 600 miles from the capital city, from Kinshasa, where I live. So I used to live in the urban areas.
Right.
And I was surprised 600 miles from Kinshasa that there could be some poor and difficult to access area like that in Zaire at that moment. I couldn't believe that.
Okay.
I didn't know that, yes. So I discovered the condition with Fogarty-funded. The thing that struck me the most was, of course, the condition itself, mostly children being affected, and then the impact. So you are working in a village and you can see like out of 10 people, 2 people are crippled.
Oh, wow.
That was the first thing that struck me the most. And the second was the level of poverty and malnutrition. I couldn't believe 600 miles from Kinshasa, from the capital city, people are living in such high degree of poverty and malnutrition. That was really something that was very striking me.
Okay.
And then the whole system, the health system, very poorly organized. You find those type of institutions built during the colonial period.
Okay.
And it was like, how come people can live in those conditions? And that was the beginning of everything. I grew up myself in modern urban areas.
Okay.
Like in the mine, I grew up in the southern part of Congo. That is the mining area, with all the institutions built by the Belgium in the 60s. So I went to good schools, mixed race schools. So I went good hospitals and things like that. But I couldn't believe that in my own country, there could be close to cities, area where there was such level of poverty I could never imagine myself. When we developed the line of research, as I said before, once we understood and characterized the disease itself, and then we start getting an idea on the biomarkers, then we had that question of susceptibility that came in. We did the first genetic study that is already published, but that one was a PCR-based sequencing of some specific gene, those involved in the detoxification of cyanide, that we look at after. But it was not enough. That was not the first level of susceptibility that was supposed to be interrogated. The second level of toxicity that was supposed to be interrogated was at the gut level, because you eat that food, it's through the gut that you start metabolizing the toxic compound, and then you can produce different type of metabolite with different type of toxicity. Yes, and Mike Bramble was just getting into Fogarty to work in an international setting. So he came with Mano. He was working as a doctoral student for one of my colleagues, Eric Villa. That's how we decided that we developed with him, because he had a genetic background. That's how we got him to look at now the microbiome aspect.
Yes.
And then there is another student looking at the epigenetic aspect of that. It's not as simple as that. The first thing that personally, with my 20 years now, I think it's, it goes fast. I have 25 years now being in that field and going to those villages. It's very clear. It is very clear that the first thing that we need to do is not at one single level, or it's not something that's supposed to be done by one team. It's something that requires systemic solution. You need to fight poverty. Because if you get a road that can go through those areas and connect different communities, improve trade, get good circulating around.
Right.
People will be able to diversify their diet.
Right.
And if you can diversify your diet, you'll be less susceptible to the toxicity.
Right.
You'll avoid malnutrition, you'll avoid stunting, and you get a better growth.
Right.
So the toxicity is there, but the toxicity is there because people have no choice.
Right.
People rely on those type of food because there is no choice.
Got it.
The wetting method just help us to solidify the evidence that there is a toxicity.
Okay.
But you can't have someone change his way of processing food the way it's been doing that for 600 years.
Okay.
And it's and then, of course, in addition to that, some type of method, when they are applied, they change even the taste of the food.
Right.
So there are areas in which, for instance, before we did the one we are doing now, in which we have introduced, we brought in a team to work on the teaching method. But at the same time, when we do the teaching method, we make sure that we also do some kind of education to promote good nutrition, dietary diversity. And for instance, in that area, we found out that after the intervention, people have abandoned the wetting method, but became more aware of diversifying their food.
Okay.
And that's what they start doing that. It's not the wetting method that have saved those populations. It's the nutritional education that came with the wetting method.
Got it.
And then when we ask questions about that, people are like, no, it's too long. And then the food, the taste has changed and things like that. So the same for what we are learning from the toxicity level. The wetting method helped to solidify the evidence.
Okay.
What we are learning for the other studies, including the epigenetics, the microbiome studies, the toxicological studies, what we are learning actually is very helpful in terms of understanding the susceptibility of the motor neuron disease, motor neuron system,
Okay.
which can be affected by any different type of diseases, genetics or not. And one of the good cases is like with Lou Gehrig disease.
Okay.
Which is very different than Konzo, in which 95% of cases are sporadic cases, in which people have been thinking about environmental influences, but with no evidence.
Yes.
So no one, either for Lou Gehrig disease or primary lateral sclerosis, this type of disease that specifically affect the motor system, no one knows exactly what are the prime mechanisms.
Right.
But in Konzo, we have a model in which we have a specific toxins that goes after energetics, mitochondrial energetics, and that kill the motor neurons.
Okay.
So that is a very good human models that can help people understand the physiology of motor neuron disease, specifically when we don't know the cause that can create irreversible disability.
Interesting.
So that is one of the global aspects and the relevance of the project. Of course, you have another relevance of the project, that is the relevance associated with the toxicity itself. We work on cyanide, which is an important toxin, chemical warfare. So we understand what cyanide can do. And that is one of the benefits that a program like the counterterrorism program from NINDS, chemical threats, can benefit from. We have been invited sometimes in those symposia to discuss the issue related with cyanide. That is also one of the global relevance of the project.
Oh, wow.
And then, of course, you have the local relevance. That is the human side of the situation, the human suffering that you see on the field.
Right.
I think so. We have developed enough capacity to understand the risk that malnutrition, chronic malnutrition, undernutrition, food toxicity, cassava toxicity bring to human health by affecting child growth.
Okay.
But so far, maybe people talk more about it because we have been able, with the help, of course, of Fogarty and NIHS, to develop a proposal in the Congo. But it's not only the Congo that is affected. There are several sub-Saharan Africa affected. You have Angola, Zambia, Tanzania, Mozambique, Uganda, Nigeria with a different type of disease, Cameroon. So there are several sub-Saharan African countries affected. Not only those countries are affected by the toxicity at that moment, but in the near future, when you see natural catastrophes like drought or flooding in Mozambique, those things, or the climate variations, those things are going to impact the way people work on crops. So the crop will also pose threat, the way they will be actually getting higher level because of the water stress, getting higher level of toxicity, of toxins, they will pose also another threat. You have cassava growing as a staple in Latin America, Southeast Asia. So it's a global problem that comes with a crop that can harbor toxins.
Right.
But with all the environmental changes coming and going on now, maybe they're not enough now to change the composition of the crop. But I feel that in the next years or decades, we will have more toxicity because those crops adapt. You cannot even change, you cannot switch, get just genetically modified crop and then bring them in those soil. It doesn't work. Okay. It will work for 6 months and then they will adapt to the soil conditions. They become even more toxic because of the water stress. So it's a global issue. That's, yes, and you have at that intersection not only the issue of toxicity, but you have the issue of malnutrition, you have the issues of poverty, you have the issue of agriculture, soil, and climate variation. So it's a very complex, and I think me personally, I will keep pushing, doing the advocacy to make sure that people understand that it's a global issue.
Right.
A challenge to human development, because if you have 2/3 of the global population being at risk of growth, it's a problem. For policymakers, sometimes they're not sensitized enough when they hear the word development. It's an issue of poverty.
Right.
And people need to work to fight and end the poverty. It's an issue of malnutrition. And it's an issue of child development. Yes. Children at risk, dying of acute toxicity or being crippled by conditions that make them disabled, unable to do anything, and suffering even more and more. So it's an issue of poverty. And the policymakers, those involved, of course, from the research standpoint, we develop the evidence, but the next step, you need to get policymakers, you need to get government, you need to get NGOs, you need to get institutional organizations, you need to get head agencies, you need to get the funding agencies, the big donors. People need to get involved to fight poverty.